All right, guys, let's get busy talking about our anger disorders. We have four conditions to talk about today. We're going to breeze through each of them, and then we're going to spend some time doing some compare and contrast because usually on test day, you will be presented with some type of angry patient, and each of these four options will be an answer choice, and we will talk about important ways to differentiate them when it comes to forming a differential and identifying the correct choice. So let's get started by talking about conduct disorder. And in my opinion, this is the scariest of all four of these disorders. This is characterized by someone who has true disregard for the rights of others. They really are a hateful, mean person. All they care about is themselves. They lie, they cheat, they steal, and they really do not care about societal norms or expectations. So, this is a repetitive pattern of breaking rules and disregarding the rights of others. Some characteristic activities are going to be fighting, stealing, destroying property, lying, and breaking promises. This is not the type of person you want to be friends with. This is diagnosed at less than 18 years old as conduct disorder. However, once you pass that 18-year-old mark, you become reclassified as antisocial personality disorder. And these patients really struggle fitting into society just because they don't appreciate or regard the rights of others. And these are usually patients who end up long term incarceration in jail, are always getting in trouble with the law, and they have really difficulty assimilating with normal society. Also, the treatment is very limited. Really, all we can do for these patients is cognitive behavioral therapy. Next, let's talk about disruptive mood dysregulation disorder. This usually will present before age 10. I like to think of this as a diagnosis, usually of our younger children, and is characterized by large outbursts that are usually out of proportion to initial stimuli. So let's say I took away a toy from little Johnny. A normal little Johnny would be upset and they might cry a little bit and be sad, but a little Johnny with disruptive mood dysregulation disorder is going to absolutely wig out. So they're going to throw tantrums, they're going to yell, they're going to scream, they're going to shake and cry, and this is going to be way out of proportion to a simple thing like taking away a toy. So crying, screaming, tantrums, and being out of proportion to initial stimuli is important. And additionally, these patients tend to be very irritable and easily upsettable at baseline. So just like at a baseline level, they're usually pretty upset and the slightest thing can just set them off. The treatment for this is going to be cognitive behavioral therapy, and we can also add on antipsychotics and stimulants. Now, let's separate this from our intermittent explosive disorder, which is usually presenting after age 6. So I like to think of this as a disorder of my older kids, like my teenagers, and maybe my older college year students. This is also going to be characterized by uncontrollable explosive outbursts, but instead of like tantrums and crying and screaming, this is going to be characterized by like punching through walls, throwing things, breaking things, maybe even assault. So this is slightly different, and it's because it tends to affect an older age group, and the activities and behaviors of these older age group is slightly different. So we have yelling, assault, property damage, and additionally, these are also out of proportion to the initial insult. So let's say that we have like a 23-year-old man who's at a bar and he's watching a football game and somebody makes a bet with him that he loses. A normal person who loses a bet would be like, oh, dang it, that really sucks. But this guy is going to like go crazy and he might throw a shot glass at the wall and like cause a huge scene. So outbursts are out of proportion to the stimuli. Additionally, these are an unpredictable pattern and they're not premeditated. So unlike our patients with the disruptive mood dysregulation disorder, our patients with intermittent explosive disorder are not really irritable at baseline. They're kind of just like chilling out, and then all of a sudden something just makes them snap and they wig out. So these wig outs are usually less than 30 minutes in duration, after which the patient usually goes back to their normal baseline, usually express remorse because they are of an older age group and are really upset by their behavior. The treatment for this is going to be psychotherapy as well as SSRIs. Lastly, let's talk about oppositional defiant disorder, which is going to be characterized by young children who just cannot stand authority. They basically want to stand up to authority figures like teachers and parents and coaches just for the sake of standing up to authority. My little brother was the classic example of this. He gave all of his teachers a run for their money. He would not do homework, he would yell, he would talk back, he would do all these things just to be mean to the teacher. So it's characterized by vindictive behavior. And I really want to highlight that word vindictive because it's all about getting back at authority and less about the actions themselves. So important here, it's always directed towards an authority figure. We need to have this greater than 6 months in duration. And this is definitely a less severe form of conduct disorder. And this is where we're going to kind of get into our differential forming. First, I just want to mention psychotherapy, cognitive behavioral therapy is going to be treatment for oppositional defiant disorder. So, in terms of our differential, let's do some separation of oppositional defiant disorder and conduct disorder. So, with conduct disorder, I like to think of these patients as like evil. They are so mean. They only care about themselves. Whereas oppositional defiant disorder are just jerks who like to make life for authority figures difficult. So that's how you're going to characterize these two. Oppositional defiant disorder is usually self resolving. Kids grow out of this. Whereas conduct disorder is going to persist into adulthood, where it's going to be reclassified as antisocial personality disorder. Now, let's compare and contrast our disruptive mood dysregulation disorder and intermittent explosive. If you remember, the disruptive mood dysregulation tends to happen to our younger kids. So we're thinking like maybe like age 5 to 16 here. So we have a younger age group here. Whereas our intermittent explosive, I think of maybe as age like 12 to 24. Okay, so the orange is going to be characterized by tantrums and like stamping their feet and crying, whereas intermittent explosive, our pink condition, is going to be characterized by like throwing shot glass at the wall, punching a hole through the wall, getting in fights, yelling at your girlfriend. So this is going to be how you can kind of differentiate the two. Additionally, our orange condition, disruptive mood dysregulation disorder, tends to be irritable at baseline, whereas an intermittent explosive disorder, they don't tend to be irritable at baseline. They just have these random 5 minute outbursts, 30-minute outbursts where they get really hot and heated and then they kind of go back to normal. So I hope this was a really helpful way for you guys to differentiate the different anger disorders as a way to do well on these multiple choice questions on our step 1 exam.